Greetings. My name is Pedro Romero, and I'm the editor-in-chief for the Journal for Immunotherapy of Cancer, otherwise known as JITC. Since 2013, JITC has served as the official open-access peer-reviewed journal of the Society for Immunotherapy of Cancer, SITC. We publish on all aspects of tumor immunology and cancer immunotherapy. And we are proud to say that as a leader in our field, the JITC website is visited around 1 million times every year by readers from more than 215 countries and territories. This video has been created to provide potential JITC authors with an in-depth look at the types of articles JITC considers for publication. We will both help you determine if your work is a good fit for the journal and also learn more about how to get started on the publishing journey with us. JITC offers diverse opportunities for authors looking for a home for their work. In addition to publishing several different article types, from original research to detailed reviews, JITC publishes graphical and video abstracts to provide an alternative way for authors to present their work. I now hand this video over to a few of our editors who will give you a closer look at the high-quality content published by the journal.
Hi, my name is James Gully, and first we will review the scope of the 5 sections that publish original research articles. The basic tumor immunology section publishes articles that explore tumor antigens, innate and adaptive anti-tumor immune mechanisms, immune regulation, immune response, cancer and inflammation, preclinical models, chemotherapy and radiotherapy interactions, and other combination treatments with the anti-tumor immune response. The clinical translational cancer immunotherapy section publishes clinical trials as well as preclinical studies. For clinical trial work, editors look for prospective studies, including first-in-human clinical trials, phase 2 and 3 clinical studies, and immune monitoring investigations. Small, single-institution-based retrospective reports are discouraged. For preclinical studies, editors look for studies that lead to mechanistic understanding or novel developments of agents and combination therapies directly related to human immunotherapy. The immune cell therapies and immune cell engineering section includes preclinical animal modeling, small and large, and clinical trials in the subject area. Content covers such areas as new targets, novel functionalities, clinical trial results, correlative studies in patients who have received cell-based therapies, novel engineering strategies, synthetic gene circuits, and gene-edited cells to knock in or knock out novel functions. The immunotherapy biomarker section focuses on the discovery, development, and/or clinical significance of biomarkers for immunomodulatory anti-cancer treatments. These include biomarkers for diagnostic, prognostic, predictive, and pharmacodynamic purposes measured using diverse strategies. This section also welcomes studies reporting novel methods, technologies, or computational approaches to interrogate the anti-tumor immune responses that have the potential to advance the field. Manuscripts in this section will be prioritized for peer review and publication on the basis of novelty of the biomarker-oriented research, adequate validation, clinical relevance, and technological novelty. Special emphasis is assigned to rigorous analytical validation of assays used, reproducibility of findings in multiple populations, data sets, models, and use of appropriate statistics to account for case stratification, data overfitting, and multiple hypothesis testing. The oncolytic and local immunotherapy section focuses on the role of therapeutic agents designed for targeting tumor cells and/or the tumor microenvironment. This includes oncolytic viruses, microbial agents, innate immune agonists, direct and systemically delivered proteins, and DNA, RNA products that act within the established tumors. Research describing the characterization and basic biology of oncolytic agents and novel delivery systems are encouraged. an emphasis on how novel intratumoral-directed agents modulate local and systemic host innate and adaptive anti-tumor immunity are of particular interest. In addition, the section welcomes translational and clinical investigation involving new oncolytic immunotherapeutic agents or those that include an oncolytic approach as part of combination therapeutic regimens.
Hi, my name is Leisha Emmons. In addition to the 5 sections previously discussed, JITC also publishes such work as case reports, reviews, guidelines, commentaries, and clinical trials monitor reports. Case reports should present relevant positive and negative findings from history, examination, and translational investigation, and include an up-to-date discussion of previous, ongoing, or finished cases in the field. JITC welcomes case reports that include novel immunotherapies, including early clinical data describing initial clinical experiences in 1 to 3 patients, clinical and/or translational results providing insight for mechanisms of response and/or toxicity, and newly emerging and/or clinically important side effects involving immunotherapy or cellular therapies. JITC will not consider case report submissions with established toxicities or responses, clinical descriptions that lack mechanistic investigations, nor preventive or therapeutic interventions, as these generally require stronger evidence. Reviews are data-driven works that accumulate several articles of importance on a particular subject or research area in a review format with the goal of providing the state of the art in the field. Topics include recent major advances and discoveries, significant gaps in research, current debates, and ideas of where research might go next, written by authors who are leading contributors in the field. Reviews are generally directly commissioned by JITC editors. However, potential authors may send pre-submission inquiries addressed to the section editors at info.jitc@bmj.com for further consideration by JITC leadership. The remaining 3 sections provide diverse contributions to the field. The Guidelines and Consensus Statements section highlights current or evolving clinical practice guidelines and consensus statements, including guidelines from the Society for Immunotherapy of Cancer, and provides guidance to enhance clinical decision-making in the field of cancer immunotherapy. The Clinical Trials Monitor section provides perspectives on late-stage clinical trial results, highlights immuno-oncology trials in progress, summarizes important new regulatory approvals in cancer immunotherapy, and addresses trial design and analysis considerations that may be unique to cancer immunotherapy. Finally, the commentary section publishes reactions to and/or perspectives on significant events in the field of cancer immunotherapy.
For more information about each of these content areas and to learn more about how to submit to JITC, please find the author instructions page on our website, jitc.bmj.com. Multiple discounts on article processing charges, or APCs, are available through JITC's publishing partner, BMJ, and JITC offers substantial discounts for JITC members, making publications more affordable for varying audiences. We look forward to helping authors share their work and advance the growing field of cancer immunotherapy. Thank you for taking the time to watch this video.